previous video we saw regarding like definition of brain abscess, causes, pathophysiology of this brain abscess. So now in this video we'll continue with the topic. We'll see about the clinical manifestation that is present in the brain abscess. So what are the clinical symptoms that will be seen in this brain abscess is that symptoms usually occur slowly, or it might take a period of 2 weeks. Okay, symptoms usually occur slowly, or it might take a period of 2 weeks. So the first symptom that can be seen, it is headache. The first symptom that usually occurs in this brain abscess, it is headache, and headache it usually occurring because the skull, in this usually what happens, this results from the raised pressure inside the skull. Okay, raised pressure inside the skull as the abscess presses on the brain. Okay, as the abscess presses on the brain. So the first symptoms usually occurs like it takes some time, or it might occur like a period of 2 weeks. Okay, it might occur after a period of 2 weeks. So what are the symptoms that usually seen? It is that the first symptom is a headache. So headache, it is the first symptom that is seen. So this headache occurs because there is a pressure created on the skull by the abscess when it presses on the brain. Okay, by the abscess when it presses on the brain. So if this abscess is seen in the lower rare area, okay, if this is seen in the lower rare area, that is in case of cerebellum. So what are the symptoms that can be seen? It is that there will be loss of balance. Okay, there will be loss of balance as well as stiffness in the neck. Okay, as well as stiffness in the neck. So the symptoms, like what are the symptoms that can be seen when the abscess is seen in the lower rare area, that is cerebellum? So there will be loss of balance as well as there will be loss of balance, or there will be like neck stiffness. Okay, or there will be like neck stiffness. And the next thing that is usually seen in this, it is mainly if the symptoms, if the abscess is seen in the frontal lobe. Okay, if the abscess is seen in the frontal lobe of the brain, you can see there will be attention span will be decreased. Okay, attention span will be decreased, and also there will be loss of memory, and there will be dysphasia. Okay, there will be dysphasia. So dysphasia, it is nothing but speech disorder. Okay, dysphasia is nothing but speech disorder. Okay, dysphasia is nothing but speech disorder. So therefore when the abscess is seen in the frontal lobe of the brain, the symptoms that can be seen, it is mainly memory, loss of memory, attention span will be decreased, and also dysphasia. Dysphasia is nothing but speech disorder. And if this abscess, if this abscess occurs in the temporal lobe of the brain, so it mainly causes the symptoms, the symptoms usually it can be seen, it is that there will be complete or partial loss of vision. Okay, there will be complete or partial loss of vision. So these are the main symptoms that is usually seen in case of this brain abscess. Symptoms usually occurs immediately, or it takes a time period of 2 weeks. So what are the symptoms that can be seen? The first symptom is headache. Headache is occurring mainly because there is pressure created in the skull when the abscess presses the brain. And the next thing is that if the abscess occurs in the lower rare area of the brain, that is cerebellum, symptoms usually seen, it is there will be loss of balance, and also there will be neck stiffness. And next, in case of if the abscess occurs in the frontal lobe of the brain, so the symptoms that can be seen, it is there will be loss of memory, dysphasia will be there, as well as attention span will be decreased. And next, if the same abscess occurs in the temporal lobe of the brain, okay, if it occurs in the temporal lobe of the brain, so the symptoms that is usually seen, it is mainly like there will be complete or partial loss of vision. So the other symptoms which is associated with this brain abscess, it is usually includes drowsiness. Okay, there will be drowsiness, confusion, seizures, fever. Okay, so the language problem will be there. And next is usually what happen, there will be loss of coordination, paralysis can be seen, and also there will be vomiting. Okay, also there will be vomiting and weakness. Okay, there will be vomiting and weakness. So the other symptoms which is associated with this brain abscess, it includes drowsiness, confusion, loss of consciousness, paralysis will be there, and then fever and chills will be there, vomiting and weakness. So this is usually the symptoms that is usually seen in case of brain abscess. The main symptoms is headache, and then loss of balance, stiff neck, a loss of memory, attention span is decreased, then there will be dysphasia, complete or partial loss of visions. Leaving this, the other symptoms that can be associated with brain abscess, it includes drowsiness, confusion, seizures, paralysis, loss of consciousness, fever and chills, and vomiting. And also the last is weakness. So these are the symptoms of brain abscess. So understood? So next is usually the diagnostic evaluation. So what are the diagnostic evaluation they go with? It is that the first thing is that they go with MRI and CT scan of the brain. So MRI and CT scan of the brain, they do it by using a contrast material so that they can visualize the abscess exactly. Okay, they can visualize the exact location of the abscess. Okay, so that they can visualize the exact location of the abscess. So in this, usually what happens, that is CT scan and MRI scan of the brain will be done, and this scan will be done by using contrast media. Okay, this will be done by using contrast media. So this contrast media they use mainly to visualize the exact location of the abscess. Okay, exact location of the abscess. Then they go with chest and skull x-ray, complete blood count it is usually done, as well as lumbar puncture is done to examine CSF. Okay, lumbar puncture is done to examine CSF. So this is the diagnostic test evaluation that is done in case of brain abscess. So what is the thing that is done? So mainly they start with CT scan and MRI scan. CT scan and MRI scan, it is mainly done by using contrast material to visualize the exact location of the abscess. Then they go with chest and skull x-ray, and then go with complete blood count, and the last is lumbar puncture. Lumbar puncture is done to examine the CSF. So this is about this diagnostic evaluation. Understood? So next is management. So normally patient should be hospitalized. Okay, in case of this brain abscess, the patient should be hospitalized immediately, and then few people required life support also. Okay, few people with this brain abscess required life support also. So you generally, when the patient is affected by this brain abscess, they start with antibiotics. Okay, so they start with antibiotics. So this antibiotics is usually given IV. Okay, so first beginning they are usually given in through IV. So they start with broad spectrum antibiotics. Okay, they start with broad spectrum antibiotics, like for example penicillin or metronidazole. It is usually given, and this should be continued for 3 to 6 weeks. Okay, the IV line, which is like IV therapy, which is started like antibiotics, which is given through IV, like penicillin or metronidazole, it should be continued till 3 to 6 weeks. Okay, 3 to 6 weeks, followed by oral antibiotics should be started for 3 weeks. Okay, followed by oral antibiotics should be given for 3 weeks. So that is usually what happens. If the patient is suffering from brain abscess, the patient should be hospitalized immediately, and few people will require life support also. So they start the treatment with antibiotics. So they start with broad spectrum antibiotics like penicillin or metronidazole, and this should be given for 3 to 6 weeks, followed by they have to give about oral antibiotics for 3 weeks. Along with this, they should also treat the other infectious disease, other infection causes of this brain abscess. Like I have told you in the causes, that bacteria enter due to the other factors such as ear infection, sinusitis, or if there is any infection the lung, chest and kidney. So all such type of infection should also be treated along with the brain abscess treatment. So that is usually about this medical management that we go. And the next is usually the surgical management. So when we talk about the surgical management, so normally in this brain abscess requires surgical treatment. Okay, brain abscess requires surgical treatment. We have to remove the abscess. Okay, we have to remove the abscess from the brain. So in this, usually what happens, it is open surgically. Okay, it is open surgically. So what are the infectious material it is present, it is removed. Okay, what are the infectious material which is present inside the brain, that will be removed, and it is washed. It will be washed out thoroughly. Okay, it should be washed out thoroughly. For this, what they do, they go with needle aspiration. Okay, they go with needle aspiration, which will be guided by MRI or CT scan. Okay, which will be guided with MRI or CT scan to remove the abscess. So that normally what is this? Management mainly includes medical and surgical management. So medical management mainly I have told you that they start with broad spectrum antibiotics, and it should be given through IV. So antibiotics which we use is penicillin. So this should be continued for 3 to 6 weeks, followed by 3 weeks of oral medication, of oral antibiotics should be given. Along with this, other additional treatment should be given for the other infections which is present in the body. And then surgical management. Surgical management, mainly this abscess requires surgical treatment, where we have to surgically open the abscess and the infectious material should be removed, and it should be completely washed out. So the surgical method that we use, it is a needle aspiration guided by CT scan and MRI scan. So this is about this brain abscess. So what is this brain abscess? Brain abscess is nothing but bacterial brain infection, which is also called as cerebral abscess. And this abscess, it is usually liquefied filled center which consists of bacteria, WBC and fluid. So this fluid is usually a pus. So what will happen? This occurs when bacteria enters into the brain, which causes this brain abscess. So causes, it includes is that normally bacteria, brain is sterile, but it usually includes like due to other infections like ear infection, paranasal infection, sinuses, or mastoid air cell of the temporal bone, or infection the lung, heart, kidney. So this is usually occurs. And normally the bacteria which causes it is staphylococcus and streptococcus. Fungus, it usually causes by candida. Symptoms, I have told you, headache will be there, loss of balance will be there, attention span will decrease, loss of memory will be there, dysphagia will be there, partial loss of or complete loss of vision will be there. And management, diagnostic, we go with CT scan, MRI scan, chest x-ray, skull x-ray, CBC and lumbar puncture is done. Management, I've told you, antibiotics will be given or it will be removed surgically. So this is about this brain abscess. Any doubts you can contact me. Thank you.